Okay, so now look at this. Genetic screening is the analysis of the person's DNA to check for present a particular allele, whether they can cause the disease or not. So this can be done in adult, fetus or embryo, or even the newly formed embryo, but this one highlight, it must be through in vitro fertilizations. Are you clear? So in this genetic screenings, this one we call adult genetic screening. This one we call as the prenatal. Okay, before prenatal genetic screening, and newly formed embryo we call as the pre-implantation. Okay, pre-implantation genetic screening. Okay, the word we use. Okay, so for adults, we carry out adult genetic screening. Fetus or embryo is prenatal before born. Okay, newly formed embryo produced by in vitro fertilization before we implant. Okay, so we have pre-implantation genetic screening. We're going to go through these three. Okay, so several methods that we can use. We can use for molecular genetic testing to test a single gene only. We want to check for particular genes, or chromosomal genetic test. We want to see where any defect in terms of the chromosome, the whole length of the chromosome, whether any mutation take place or in terms of number. Okay, and we do know that genetic testing is voluntary. No one will force you. Okay, and the result, okay, the decision about whether to be tested is a personal and it's very, very complex. Okay, whether you want to go for testing or not, but after you have gotten the results, then you can go and see this. Okay, get a consultation from the genetic counselor, so that they can provide the information about the pro and cons of the test, providing information on inheritance of the illness and recurrent risk, and also support the patients and their family dealing with the illness, and discuss the social and emotional aspect of the testing. Basically, before the test, they will tell you, okay, you may face these kind of problems, you may face this kind of emotional aspect, so how you deal with it. Okay, and basically genetic counselor will encourage patients to make their own decision based on the given information. So it means that those information must be given in a non-directive and supportive way. Okay, you try to imagine that, okay, you've done this before. I mean, you come in for the A level. Okay, so the counselor will tell you, oh, you want to choose A level. Oh, it's very difficult. Okay, the fail rate is very high, and blah, 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 blah. So this is directive. Means that even though I don't tell you that don't choose A level, you will say, oh yeah, based on this, I don't want to choose A level. Okay, so means what's mean non-directive? Non-directive will give you a supportive way. Okay, will tell you that, okay, you can choose A level. Yeah, it's tough and blah, blah, but with this skill and this effort, you do it, so you shouldn't have any problem and blah. So it's a non-directive and supportive way. So you will be the one that make your own decision based on the informations given. Okay. So we're going to start it with the first one, adult genetic screening, and why this adult genetic screening is carried out. So the most common reason for adult to have genetic testing, because they want to know whether they are carrier or not. As I say that some of the disease, they are recessive disorder. So recessive disorder means that if you have one copy of dominant allele, the dominant allele must affect recessive allele. So it means that you won't see the disease. But when two carrier, then 25% of the chance, okay, of the offspring were going to have the disease. Okay, so carrier testing is used to identify the asymptomatic individual who carry one copy of recessive allele. Okay, when the children receive two copies, it can cause the genetic disorder. So this type of testing offer the individual have family history of genetic disorder, for example, thalassemia, blood disorder, cystic fibrosis, Huntington disease, and sickle cell anemia. So if both parents are tested, then it can provide information about the couple risk of having a child with the genetic condition. Okay, now thalassemia is an abnormal form of inadequate number of hemoglobin. So people with mild thalassemia do not require any medical treatments, but with severe one, they need the blood transfusions. Okay, so we have the alpha and beta. Alpha basically alpha globin change affected, beta basically beta globin change. If you are interested, you're interested to know more about thalassemia, these are the information of thalassemia, you can go and have a look. Okay, I won't go into detail about this table. You can have a look. So other benefits, okay, what are the other benefits of adult genetic screening includes to determine if the healthy individual will develop disease, for example, breast cancer or Huntington disease later in life. So basically means that we won't know whether we were going to develop or not. For example, BRCA1 and BRCA2 genes, I will explain later. Okay, to determine if the genomes of an individual have certain allele that indicate necessary for lifestyle or environmental modification. If let's say you check your genome, okay, a particular person may develop type 2 diabetes if they don't change their lifestyle. So from the genetic screening, then we do know. Or to tailor disease treatment as well. So means that, for example, we were going to find the better treatment way to treat that particular disease. Okay. So BRCA1 and BRCA2 genes, okay? So the BRCA mutation is a mutation either on the BRCA1 or BRCA2 gene, which is tumor suppressor gene. So it means that under normal condition, if they are normal, they should help us to suppress the tumor development, okay? So only 5 to 10% of breast cancer cases in humans due to the mutation of BRCA1 and BRCA2. So women with the harmful mutation, either BRCA1 or BRCA2, have a risk of breast cancer about 5 times compared to the normal risk. So if the result tested positive, a woman may elect to have the breast removed, okay, before the cancer appear. So in a woman who has not developed breast cancer, removing the breast may reduce her risk of ever being diagnosed with the breast cancer by 90%. Okay, so basically means that if a person go for the genetic testing, BRCA1, BRCA2, either one of them actually are having this mutation. So 5 times higher the risk. But if they remove the breast before the cancer development, then it can reduce to about 90%. And the plastic surgeons can help to reconstruct the breast back later, okay, for aesthetic purposes. Okay. So in this case, you can see that mutated BRCA1s will develop the cancer by age of 70, about 55 to 62%. Mutated BRCA2, about 45%. Normal BRCA, no mutation, about 12%. Okay, the risk there. Okay, about 5 times. Consider about 5 times. Okay, but again, 55% and 45% is not more than, so you still have chance not to develop the cancer, right? Because the ethical issues here is after you, I mean the dilemma here, after a person that tested positive, will they straight away go for the breast removal or not, or mastectomy in this case? Cannot. Okay, so this is one. And also for BRCA1, BRCA2, okay, because why? Breast is not a vital organ. You can still survive with the removal of the breast. For example, testes, ovary, uterus, cervix, penis, okay, those are okay. You can remove them, you still can survive. Okay, but the question here is if that's a vital organ, let's for example, lung, liver, how you remove it? Okay, you can't remove it. Okay. Huntington disease. Okay, Huntington disease, as I said, that Huntington disease is an autosomal dominant. It won't develop. It's a progressive process. So means that a person that get the Huntington disease may be at the age of 30 or 40 by the time they already, okay, married, and they already have the kids. So means that this Huntington allele may be passed on to this dominant allele can be passed on to the offspring, cannot, okay, or son and also the daughter here. So it's a late onset. So why we need to do this? The checking actually what's the benefits? So for the family planning, you want to plan whether, okay, since I have the Huntington disease, okay, I'm carrier of dominant allele, so maybe I don't want to have the children's at all. Okay, but again, we do know that there's no cure for the disease. A person with dominant allele may develop, okay, or people with family face the dilemma in this case. Why? Because should they have the genetic test to find out whether or not they have the dominant allele for this disease? There's the question, should I go? If let's say I have the family history, okay, my family member have Huntington, should I go for this? Okay? Would they rather to be told that they are at high risk of developing Huntington disease, even though nothing can be done? So it means that if you are at the positions, will you go for the Huntington checking or not? Okay, this genetic testing or not? Okay, would you like to be told that, okay, yeah, in my life, I may develop this disease. And I do know that nothing I can do because no cure. Okay, so is it a good idea to have the information before they start a family? This is a question again. If I don't know, maybe I can have the kids. But now, okay, and my kid may not have the disease, correct or not? But the thing here is I'm told that I have the Huntington disease. So should I start a family? If I start a family, then my kids, how? So you in this kind of dilemma when faced by the Huntington patient. So again, this is very important. Okay, question always asked about, question did ask about this. Okay, where Huntington patients, should they go for this genetic testing or not? Okay, so we come to the second type of the testing called prenatal genetic screening. So prenatal genetic screening basically means that at the fetus or embryo level. So two methods, amniocentesis and chronic villus sampling. Okay, amniocentesis and chronic villus sampling. So what are the main difference between these two? If you look at this amniocentesis, it takes place slightly later. Okay, what we're going to take, we take the amniotic fluids. Okay, amniotic fluids. Okay, from the amniotic sacs here with the ultrasound guided. We don't want to poke and then poke into the baby here. So basically through the abdominal wall and then to the uterus wall, we take the liquids, the fluid here, because the fluid will contain the cells from the fetus. So once take the fetus cells ready, we can go for the genetic screening. Can you see that? Poke through the skin and then your uterine wall. Okay. And another method, we can take it actually from the chronic villus sampling at the placenta there. So we can use the speculums to widen the vagina here and put in the catheter. So this catheter will go in, enter into the chronic villi. So understand the concept here. This part is the placenta. Always remember placenta cells belongs to the fetus. So from here, we can take some of the cells and do the analysis. Okay, again, must use the ultrasound again to check. So both methods not 100% accurate. Okay, definitely. And the risk is the miscarriage. Are you clear? That is a risk of the miscarriage. Okay. So you can try it. So amniocentesis take about like 4 months after pregnancy, 15 to 16 weeks, 4 months after the pregnancy. Okay, so we check for the chromosomal mutations. We get into the amniotic sac with ultrasound guided. So chronic villi sampling, it can be slightly earlier, about 2.5 to 3 months times of the pregnancy. So it give early warning. Okay. So we get from the placenta a small sample of the placenta, the region of placenta called chorions. Okay, chorions. So we check for the chromosome, but as I said that they have risk of the miscarriage. Okay, about 2 to 3%. Okay. Sorry, 1 to 2% they miscarriage, but a typical miscarriage rate about 2 to 3%. There is a small increase of the risk by 1 to 2%. Okay, so when the fetus were identified of having the inherited disorder, so they were advised by the doctor in this case whether to terminate the pregnancy or not. So this kind of terminate of the pregnancy due to the medical reason is known as a therapeutic abortion, not simply because of having the pre-marriage sex and then having the kids. Okay, sorry, not pre-marriage sex, but unprotected sex in this case, and having the kids. So this is called it's not called therapeutic abortion. Therapeutic abortion because of medical reasons here. So what are the unethical abortions? Unethical abortion, basically decision on abortion has been made even though the defect have been relatively minor. For example, thalassemia minor. Basically, the kid will be able to live. Okay, right. But the thing is, abortion take place because a minor one. Okay, so some parents are decided to terminate pregnancy simply because the child is not the sex that they want. For example, they want a daughter, but the thing here is when they check the screening, so the screening and then told that they have a very minor genetic defect. Very minor, basically these child will be able to survive. But the thing here is because oh, it's not female, it's not daughter, then they terminate. Okay, so this is called unethical abortions. Okay. Now we come to the last part of today's topic. We talk about the pre-implantation genetic diagnosis, PGD. So please, this one only can be done, highlight guys, in the normal process of IVF only. Are you clear? Why? Because female will only know whether they are pregnant or not after they miss their periods, after the sexual intercourse, right? By this date, but delay already get late in this case. So what we have to do? At this moment, you can't do anything already because implantation already take place. Okay, implantations already take place. Okay, so pre-implantation means before implantation. So before implantation, this only can be done by using the IVF. Okay, IVF. So what actually happened here is very simple. Okay? In this case, the cell from the embryo, okay, from the IVF will be taken, 1 or 2 cells, and then we can actually check. So if got problem, this embryo will be destroyed or we won't be implanted. If no problem, will be implanted here. Okay, so why embryo, not the zygote? Zygote only 1 cell. If you use it, then no more. So zygote, no. So some students use the word zygotes, is not correct. It must be embryo. Embryo, basically, we have more than 1 cells, right? So we have a group of cells, so 1 or 2 we can take out. Okay, and then we can do this pre-implantation genetics diagnosis. Okay, so you can try the questions. The answer is here. So what is the good thing regarding to the PGD, a pre-implantation genetic diagnosis or screening, compared to the prenatal diagnosis? We reduce the ethical problem. Why? Because we don't need to do the abortion. Before the implantation takes place, we already check for genetic any defects of the genetics or not. Okay, so reduce the ethical problem here. We will compare to the considerations whether abortion need to take place or not if you go for this prenatal diagnosis. Okay. So what are the ethical issues of the pre-implantation genetic diagnosis? So this PGD may also be used to select embryo that can become suitable bone marrow donor to seriously ill sibling. Now, this is what actually happened here is, if let's say the sibling have the bone marrow problem, okay, defect in bone marrow, so parent actually can do this. Okay, so carry out the in vitro fertilizations, and then we choose the one that match, and then we implant. So when these kids are born, they can actually donate the bone marrow to the elder brother or elder sister. So this is one of the concerns. So the goal of preventing certain serious disease give rise to ethical question: which disease should be considered serious enough? You say, oh, this is very severe. How severe is severe? Thalassemia severe or not? Sickle cell anemia severe or not? Can you see that? But we cannot actually say, oh, sickle cell anemia is very severe. Then it will give us this problem called stigmatizations, like COVID, right? Before, oh, you got COVID. Oh, this place got COVID, so we won't visit. So in this case, we create the discriminations. Okay. So embryo are created that a couple never intend to use because they have the genetic disease. Most likely, you won't be adopted and unimplanted embryo that carry the unwanted mutations. So therefore, what we're going to do with this? So we have shared the moral status where we discard, is it the same as abortion or not? Okay, so PGD may also use to select the sex of the embryo that parent choose to implant, which is unethical. Okay, so means that you use a PGD, you check, you know that, oh, it's male or female already, then what happened? You're going to choose, right? You can tell the embryologist, oh yeah, I want a male only, I want a female only. Okay, so with this, I've done for today topics. Okay, do you guys have any question?